Hello, good afternoon everyone. This side Dr. Bharti from RadarOpus Software team. So today we are here to organize webinar with Dr. Prashanth on the severe cases of anxiety. He will tell us that how we can manage the severe cases of anxiety with the help of RadarOpus software. So Dr. Prashanth Viswanathan is a consultant homeopathic physician practicing for last 18 years in Bangalore. He has done BHMS from RGUHS Bangalore and postgraduate degree from NESH, that is New England School of Homeopathy in Amherst. USA SCPH and SCPH Plus from Predative Homeopathy Mumbai. He is a direct student of Dr. Paul Herscu. He is a specialist in emergency and chronic cases. So this was a brief introduction of Dr. Prashanth. Now Dr. Prashanth will tell us about the management of severe cases of anxiety. Dr. Prashanth, now hand over to you. You can start the presentation.
Okay, a very happy Hangman Day today. World Homeopathy Day we celebrate today. And let me begin this seminar by remembering what Dr. Hahnemann wanted inscribed on his grave. He said in Latin he wanted it to be inscribed non inutilis vixi, and that is what is actually inscribed on his grave in Germany. That is what is inscribed on his grave. So for those of us who probably don't know what it means I did not live in vain. It means that I did something with my life. People usually say I did not die in vain, but die everybody does. So it is not important to die. What is important is to live, and you should not have lived in vain. Okay, so today we are going to be talking about management of cases with severe anxiety. Today's webinar is going to be a refreshing change from all the other webinars that you have probably attended so far. It will give you an insight into how to manage complex cases in homeopathy. So without further ado, let us start. So what are the key points? The key points, because we are going to be dealing with anxiety, let us define anxiety. So what is anxiety? Anxiety is a disease syndrome which actually develops over months and years and results in deep behavioral patterns, which I would call the disease of the mind, and the deep pathological patterns, disease of the body. So now, when I say behavioral patterns, we all of us have some pattern, pattern of behavior, physical body patterns, mental thought patterns. The moment these thought patterns go in a direction wherein it causes us to become anxious, to be worried, and those patterns keep on repeating over many years, that is what we call anxiety. Anxiety is a state wherein is a state of worry, is a state of fear, and it's a state of unnecessary care and some kind of feeling not quite right in the mind, because something is there in the mind which prevents a person from getting relaxed. So these things may start out as some kind of simple behaviors, but over time they become embedded into deep behavioral patterns. Now what we find out in our generally in homeopathic practice is that a single constitutional remedy, which is usually touted as a miracle cure, it is unlikely to cure cases of anxiety which have been there for many years. Now, to treat anxiety, we need to treat the psychological as well as pathological manifestations of it. Because once the mind gets impacted, the psychology gets impacted, it is a given that the body also gets impacted with it. And so you are going to see pathological and physiological manifestations of the anxiety. So I wanted to talk to you a little bit more about what exactly is a constitutional remedy. Now, I wanted to remove some misconceptions also. So there is no miracle drug which removes all the symptoms of the patient in a single dose or multiple doses in a majority of the cases. This is impossible. You will not have a single miracle drug which removes all the symptoms of the patient in a single dose or even multiple doses. Usually this is the case. Okay. That doesn't mean that you don't have a case wherein, a very complicated case for which you have a single constitutional remedy and that works over many years or many, many months. For every situation, that constitutional remedy works. Yes, but that is by far very rare. It doesn't usually happen in practice. What we see usually in about 80 to 90% of the cases are that we notice a series of remedies which are needed, which are based on the presenting current signs and symptoms. And before we reach a remedy which appears to do the maximum good to the patients. Now, we would give probably 5, 6, 7, sometimes more medicines, sometimes less. But then at that point wherein we come to the realization that, yes, this remedy is going to make a deep impact. You get a feeling for a constitutional remedy and you get a feeling for the time wherein that is applicable also. For normal remedies, usually you don't get that feel, that it factor, that yes, this is the one thing that is required by the patient. So what actually happens is, after a period of time of giving multiple remedies, there comes a time wherein the homeopath in his interaction with the patient comes to a remedy, and that remedy would be the main remedy for the patient. But that doesn't mean that all the previous remedies were inaccurate or less effective. They all play their role. Even the previous remedies, they play a role to remove all the obstacles. And once those obstacles are removed, the so-called constitutional remedy can work without, much hindrances, without obstacles. So that is what is the actual constitutional remedy. So in pursuit of trying to understand what is this constitutional remedy, I will take an excerpt from 𝐬𝐩𝐞𝐫 Vitolkas. This is volume 1 or 2, wherein he talks about ammonium carb. He talks that the constitutional remedy, simply because it's a deep acting remedy, it is not a constitutional remedy. And he goes and he describes what it is, the constitutional remedy. He says, I have come to realize that all remedies can act deeply when they are truly indicated, when they are the synonym. Consequently, any remedy may act as a constitutional remedy when appropriately prescribed. Any remedy when only superficially prescribed will have but partial action. And conversely, any remedy when properly prescribed according to deeper indications can affect the entire constitution. Now, what he says, a very important statement he makes here. The strange phenomena seen in everyday homeopathic practice is that many times superficial remedies have to be prescribed before the real constitutional remedy can take effect. So this is exactly what I was also talking about. This is the experience of every homeopath, every seasoned homeopath, that before you come to what is called as a constitutional remedy, which appears to have the maximum effect on the patient, there will be some approximate remedies, some remedies which are equally good, but they don't appear to be doing as good to the patient as the constitutional remedy. It just means that all those previous remedies were equally required to remove the roadblocks to cure. And when the roadblocks are completely removed, suddenly you give the constitutional remedy. It appears to be working like magic, but it doesn't mean that the previous remedies did not have any impact. They were equally well indicated and they also did their job. So now, without further ado, let us go with our first case. This is a case of severe anxiety with hypertension. Now, this case is in brief. This is a case of 54-year-old female with severe anxiety and blood pressure. This is accompanied by extreme giddiness with an inability to coordinate and loss of balance. So when a person has some inability to coordinate, you can understand that there is a cerebellum dysfunction. Giddiness itself is, just basically you're sitting and the world seems like spinning. But when somebody has an inability to coordinate and a loss of balance, you will see that it is a cerebellar dysfunction, wherein hearing, etc., is also involved. So other issues that this person had: sciatica pain, varicose veins, thyroid issues, urinary incontinence, gastritis, L4, L5 back pain. You can see a host of issues. But the primary issue that she came up with was severe anxiety, for which she was taking blood pressure tablets. So the first prescription happened on 27/20/24. Now, with the BP medicines, her BP was 140/100. And she's been on BP medication for almost 10 years. So the first prescription goes with all her pertinent symptoms that she mentioned. She said that her anxiety was much worse, basically in a crowd. Her mood used to alternate between being very happy then anxious. She has an issue with her bladder wherein she cannot control herself. She has to immediately rush to the bathroom to urinate. Then she has gastritis issues. So all these things, when we consider the totality of the most relevant symptoms, I'm not going in very detail about her case history because that would take up the whole webinar. That is not the purpose of this webinar. So the first prescription came out with Aconite 10M. So now when you look at this, you have all these remedies that are coming up. It is not necessary that Aconite should be the right remedy or Aconite should be the remedy that she should be given. The important thing to understand is that she's a very, very sensitive lady. And when we come to the conclusion that she's reacting intensely to situations, towards a crowd, towards maybe somebody, 2 or 3 people, talking to her in a closed space. So you also get the feel that she needs a remedy which is coming from a plant, and she's super sensitive. And you can look at it that Aconite or the Ranunculus family is one of the main remedies which has psychosomatic manifestations. So considering all that, you see there is one more remedy that comes up in the repertorization, which is Ranunculus bulbosus. And then you see all these remedies. So when you see this, you know that Aconite would be a very good fit for the case. So after giving Aconite 10M twice daily 5 days, the follow-up happens after 10 days. So the anxiety levels are much better. They are reduced by about 10%. She's kept on placebo. After about 10 to 12 days, she comes up with a new complaint, which is inflammation of the right knee. And she tells me that she also has varicose veins. So you see, the patient will not reveal usually all the complaints in one setting. He will keep adding to the complaints. She says, this is the issue. And she says, doctor, a neighbor of mine told me use Volini, it will go away. But I applied Volini and the pain increased rather than subsiding. So following day, I gave her a single dose of sulfur 200, which actually resolved her complaint within an hour. That is what she told me. So there were some other prescriptions along the journey. After a few days, she came saying she had an old fracture of the right ankle and foot. And so I gave her Rutagraviolens 1M for that. The remedies were given either in a single dose or repeated doses. So that is not important. Wherever it is relevant, I will mention the repetition also. Then Silesia 1M was given for anxiety and pains in the tendon. Tuberculinum 10M was given on 20/12/2024. And again, the tuberculinum 10M was given based on her anxiety levels, based on her necessity to continuously keep busy. She told me one strange symptom that, doctor, if I keep busy, I am well. But the moment I relax, I have issues. So occupation, desiring to, the continued motion ameliorate, these are all suggestive of the tuberculinum miasm. And when we prescribe in the manner in which I do, we actually remedy the miasmatic states also. Now, the miasmatic states that a person has are remedied through nosodes typically, and so tuberculinum 10M was given. So she felt better after that, and then later on she again came back saying, doctor, I am not able to relax. I get anxiety. I am not able to sleep properly. The moment I relax, if I'm busy, nothing happens. So this is again like the remedy tuberculum was prescribed for that. But I'm having this restlessness and having this inability to relax. So what I did, I gave her Kali Ars considering the totality. Now you look at it, Kali Ars has a very important symptom that it is having an inability to relax. The moment it relaxes, anxiety starts. It's a funny kind of remedy, that itself has a cycle which can be described at some other time, maybe. And the moment they lay down at night, they start having thoughts. Okay, I have to do this, I didn't do this, etc., etc. And they start having palpitations because of the anxiety. Again, psychosomatic manifestations. So Kali Ars was given 1 m in 1 m potency. Again, it was repeated twice daily for 5 days. Further remedies that were given, Lycopodium 1 m was given as an antipsoric for severe giddiness, gastritis. Thuja 1 m or nitric acid 1 m was given based on the tremendous anxiety about her health. She used to have tremendous anxiety about her health. Doctor, nothing will happen. No, my BP is going higher. Every time she would get some kind of giddiness, she would check her BP. Extremely hypochondriac. So nitric acid 1 m was one of the antipsychotic remedies which she needed. Thuja followed nitric acid after some time because she was a very, very weak personality. They say delusion brittle is. That is how I look at Thuja, a person who doesn't have the inner strength, the inner willpower, who basically has this duality of mind wherein his mind is not stable, body is weak. Thuja is indicated. Later on, there was a very important remedy that was given to her, which was Crotalus horridus 1 m. It was given based on the conflict between the need to do her duty and the frustration that comes from not having their own space. She's a lady which is a Kali. She has to do her duty. But then as she goes about doing her duty, she basically feels very bad that she is not able to do anything for herself. She has no time for herself. And that particular frustration is beautifully captured by the delusion, delirium, mind, delirium, bed. Escapes, jumps up suddenly from bed. She's lying down in bed. Suddenly she gets up from bed, and in the night, sometimes in the evening, afternoon when she's sleeping, that is an indication, is a indirect indication, basically, for a patient saying, I need to have my own space. So the fact that delusion, enemy everyone is, delusion she is neglected, delusion people behind him someone is, all these things are indicative of this conflict between the need for duty and the frustration that comes from not having their own space. So Crotalus horridus, basically for this, a certain understanding of delusions and deliriums are important. But basically, a lady who feels neglected, she does her duty. Snakes are generally, you should know the themes of snakes, like Lachesis. They are also, even Crotalus, very, very duty conscious people. And then, even though they are duty conscious, they feel that somebody is behind them, always troubling them, that kind of a theme, the overall theme or the essence of the remedy of Crotalus horridus. Now, finally, we come to the remedy Coculus, which we come to finally the constitutional remedy. After some days, she came to the clinic. She had been okay. One important thing to note is that after the last 3 medicines, her BP medicines were stopped, especially after lycopodium and nitric acid, because it so happened that if she used to take her BP medicines, her giddiness and her BP used to go low. And so I said, if BP goes high, there is no issue. But if BP goes low, then you may have a problem with your life. So I asked her to stop all BP medicines because it was consistently going low. So it would go high once in a while. That was during her anxiety. But apart from that, her BP would always go low. So I said, stop all BP medicines. Then when the BP medicines were stopped, and she was stable for some time. She came for her usual consultation. This time I did the case taking in little bit more detail. This is like, the time, and this was the time also wherein she was very open about what her problems were. Her son had called me up the previous day that my mother has a problem. She's always on phone 4 to 5 hours a day, and we don't know what to do about it. So I decided to talk to her and find out what the issue is. She says she worries constantly about others. Everybody keeps calling her for a solution to their problems. And she feels guilty that she is not able to help others. She is not at all concerned about what happens to her. There is an element that is like a nitric acid hypochondriac that is there, but her majority of the time is occupied with having this anxiety for others, trying to find a solution for others' problems, virtually giving her life for others. So, based on this, Cocculus indica came up as a remedy through a flat repertorization. You see, now you can see. But more importantly, I will leave this slide on for a couple of maybe another 10 or 15 seconds. Look at all the rubrics that I have considered. But more importantly, consider the different kind of rubrics I have taken. And so I'm going to show you a different kind of repertorization. See, there were certain segments. I call this a segmented repertorization after Paul Herscu. He is the person who came up with, Dr. Paul Herscu came up with this idea of cycles and segments. So I use this frequently in my practice. So anxiety for others is one idea. Then guilty that they are not doing enough is another segment, is another idea. Overexerting themselves, the third segment, is another idea. Sleeplessness after overexertion is another idea. Then you have a physical manifestation of the anxiety, which is vertigo, fall, tendency to. When we put all the symptoms into the right kind of boxes, for example, anxiety for others, you see a couple of symptoms expressed there. Then guilty that they are not doing enough, mind discontent himself with. Mind duty, too much sense of duty. Mind anxiety conscious, anxiety off, anxiety conscience off. All these represent the same general idea that they are not doing enough. Overexerting themselves, another idea. Cares full of eating, not eating when, full of relatives about, cares full of trifles about, ailments from cares, worries about for loved ones. Then vertigo, all the issues that she was having, sleeplessness after overexertion. Now, what I found out was her ear would used to pain, okay, after she would talk a little. And I understood that she was having the cerebellar issues, which I talked to you about vertigo. The vertigo was caused because of a cerebellar reason, a disorder or a physiological or a pathological issue with the cerebellum. And that in turn was caused because of talking on the phone for 4 to 5 hours. That also finds its manifestation in that particular segment, vertigo, fall, tendency to. So now, sleeplessness after overexertion is its own segment. So when we do the repertorization using Herscu's cycles and segments approach, you get about 7 remedies. There is an end to the repertorization, and you get a small remedy, only one small remedy, which is Cocculus indica. And what are all the rubrics that Cocculus finds itself in? All these segments and the rubrics that cover those segments are illustrated in this particular window. So follow-up was something remarkable. She came and she said, "Doctor, I don't know what you gave me. I hardly have any anxiety attacks. I feel as if a cloud of darkness has been lifted from me." She says, "I'm literally transformed." Okay. And the medicines, she says, among all the medicines that I gave her, this medicine has had the maximum impact on her state of mind and health. And she gives this. I have a recording of this also. If time permits, maybe I can show you at the end. She offers this information voluntarily without me even asking. Now, what are the key pointers to Cocculus indicus? Sorry, there's a typo. It is indicus. So they have a tremendous anxiety for others, a sweet feeling for others, which leads them to feel that they are not doing enough for them, for other people. So they exert themselves to help, to do, to act. Then they exert themselves to the extent that they enter into an inflammatory state of nerves wherein they just cannot settle down. This actually leads them to lose a ton of energy, becoming loquacious. Then this causes some kind of manifestation which can be like bleeding. Then that leads to a certain kind of disoriented, confused, and vertigo. So it directly affects the brain, you see, and then it goes and causes a symptomatic manifestation. So the losing of a ton of energy need not just be bleeding. It could be, for example, continuous talking with other people. Eventually, it would have an impact on the brain. Talking a lot, brain becoming very, very, weak, not able to concentrate, feeling the headaches. She used to have headaches quite a bit. All these things would come under bleeding. Bleeding is just a metaphor that tells you what is happening with her. Bleeding also includes excessive talking, losing energy. Then finally, she ends up in a state wherein she is disoriented, confused, and having vertigo. So this is a cycle of cocculus. Leave it on for a couple of minutes for people to watch. Again, many of these slides, have been adapted from Dr. Paul Herscu's Cycles and Segments. And all credit is due to him for teaching us that the remedy is not just a bunch of symptoms, but it has a certain progression in time. So you see, for example, here it starts with anxiety for others, the first segments at the top, then goes on to feeling guilty that they are not doing enough. Therefore, they exert themselves too much, which leads them to enter an inflammatory state of nerves. Then the bleeding comes up, then the vertigo comes up. That is a cycle of cocculus. So we go after a couple of seconds. Maybe I leave it on for 5 to 10 seconds for people who want to absorb this approach towards case taking. So now we come to another case, case 2. This is a case of severe social anxiety with amenorrhea. Now, what is this case? This is a case in brief. She is a case of an 18-year-old girl who studies engineering. Okay. She's a very shy girl. She has other complaints. Her other complaints are excessive body heat, intolerable body heat. That is what she told me. She has hypothyroidism, which has recently been detected. She has amenorrhea. From the last 6 months, she has not menstruated. Before that, she had menstruated. Her menstrual cycle would be once in 7 or 8 months. This last time it was 6 months. She is grossly obese and overweight. She is 86 kg. Mentals. She's very shy and introverted. She's bashful. She has extreme social anxiety while talking to her friends and others. She has a lot of acne in her face, which is aggravated, especially at the time of menses. Lot of overthinking and lack of concentration. She is in her engineering and she feels that she just can't concentrate. So she stays up late at night trying to concentrate and she doesn't even sleep properly. She has a lot of cravings for sugar and carbohydrates. What is the causation? When I delved into the history of the lady's case taking, these two were the main things that came up. The girl's family lived in a joint family setting. Her father's brother was a very rude and violent person. There would be a lot of quarrels in the house. She was originally a very bubbly child and was highly extroverted. Very bubbly child, highly extroverted. These incidents caused her to become highly introverted and become more and more preoccupied with her inner world. See, what actually happens is when the external environment of the person is not good, what I have found out is from extroversion, a person goes towards introversion. This is the beginning of disease. Usually an extroverted person has, the tendency to catch diseases is much, much lesser as compared to the introverted people. When people become introverted, they tend to catch more diseases and everything follows from that. What I found out some genetic causes, that the girl's parents are cousins. They are from a Sindhi family, and so they do not usually find matches because Sindhis are not much in preponderance in our country. They are a minority in our country. So Her younger brother was born premature and suffers from severe developmental delays and also birth defects. So initial consultation was on 5/8/2024. She's not been able to sleep till late at night. This causes her to stress out frequently when she wakes up in the morning. Excessive hunger, she cannot control her appetite for frequent junk food. She cannot focus on her studies. Poor concentration, her mind gets distracted easily. She's highly introverted and thinks a lot, keeps on thinking, overthinking. It's not that she has poor concentration. Her mind gets distracted. She cannot focus. But when she's alone, she keeps on thinking about a ton of things. Her mind goes out of control. So repertorial totality, and this is the repertorial totality. Based on the repertory, her shy nature, the excessive heat, and strong and uncontrollable appetite, natrum iode 1 mg single dose was given. Now, follow up after 18 days, she's sleeping better. The frequent eating remains the same. Now, there was an issue with the frequent eating because she was continuing to put on weight. She was already like 85, 86 kgs and she was increasing weight. She had probably come to 87, 88. And so that needed to be addressed pretty soon. So based on her company aversion to and increased appetite, lacvaccinum defloratum was given on 23/8/2024. Now, as you can notice, these may be called superficial prescriptions, but until you really get to the essence of the person, it is not correct to simply keep giving the patient placebos. That approach is something that I would not agree with. Yes, usually it is noticed that to come to the deeper remedies, the doctor needs to know the patient better. It is not possible to know your patient within a single setting or a couple of settings. In my experience, what I have found is you need at least 3 or 4 months before which you understand your patient deeply. In spite of the whole case taking you may do, in spite of the detailed case taking you may do, the patient himself or herself may not be comfortable expressing their deep inner truths to you before a certain period of time. So, but at the same time, you need to develop confidence with the patient that you are taking them in the right direction. Further, the so-called superficial remedies, they will have an impact. For example, this lacvaccinum defloratum, lac defloratum 1 mg, caused a drastic reduction in her appetite. So after that, she stopped putting on weight. So then medorinum 200 BD for 4 days was given as an anti-miasmatic. Iodam 200 was given considering the heat in her body. And this was continued for some time. It was given on 12/9 in 200 potency, then 1 mg potency on 27/9. Each time it was repeated for 6 days. After, the series of remedies, she stopped putting on weight. She did not reduce weight. Her weight became stagnant at 86 kgs. Then the tremendous heat in the body actually reduced. Then she started having her menses at the beginning of October 2024. So she came back. The menses had come back, but she was having extreme pain, severe dysmenorrhea. And I tried to elicit the exact sensation that she had. I wanted to know the exact sensation. And she's a Sindhi, so she speaks comfortably in Hindi. I asked her, what happens? Kaisa feel hota hai? What exactly happens? She told me one single sensation. She said, यहाँ पे ऐसा लगता है कि सिकुड़ रहा है, कोई squeeze कर रहा है. Sikudna means to actually squeeze. And based on this, there's actually a single remedy: pain, uterus, menses during, squeezed as if, Kali Iode. This is a purely pathological prescription. There was no, the mentals were not given an importance to when I made that prescription. But subsequently, there was a delusion that caught my attention, just around the time I was ready to prescribe. That delusion was accidents, threatened with an accident he was. So I reasoned that the reason that she became introverted about 4 or 5 years back was because of the extreme quarrels, that sense of violence in her house, that kind of threatened feeling that, something would happen to her. There, that delusion was there. And I reasoned that somewhere that delusion made a mark in her mind. So I was much more confident with Kali Ayod, the prescription that was given. It was given in a single dose. The dysmenorrhea resolved within an hour of taking the first dose. It never came back. Even though she had multiple menstrual cycles, after that, it never came back. So after that, some remedies that were given in the course of the treatment were Lechesis 10M, Baraita Carb 1M for the extreme shyness, Lechesis 10M for still the heat in the body was quite high. Many times we hear that Lechesis 10M is loquacious. The thing is that Lechesis 10M is not just loquacious, it is deeply introverted also. They are deeply introverted in a way wherein their mind is loquacious. So whenever somebody says, you find a person who doesn't talk much, he's introverted, make sure to ask them whether their mind thinks a lot. Then you will come to Lechesis 10M. So around the end of 2024, her generals had stabilized and she was menstruating once in 2 months. The heat in the body had significantly reduced by this time. So now she comes back on 15/11/2024. She's bothered by her extreme acne, which has aggravated heavily this time at the time of her menses. So initially, it took her some time for the menstrual cycle to get regularized. She started having once every 1.5, 2 months. But then the last menstrual cycle, she said that she was having extreme acne. I saw her, the face was full of reddish acne and oily face along with that hair. So I took the presenting symptoms at that time. Face eruptions, acne, menses before, skin hair, growth of hair excessive. Then I found out that I took a rubric saying the menses was irregular. Then I took the hair distribution in her generally. Generally, you will notice that in PCOD cases, because she had PCOD, she was not menstruating regularly. And you enter into a situation wherein the so-called PCOD syndrome, you start developing all masculine symptoms. And she had that distribution of hair in her body, which was masculine. Taking all these symptoms, I came to pituitary, anterior pituitary adenophysis 1M. I gave her this SAR code, pituitary anterior 1M BD 3 days. I gave her this because there was issues with her growth also, including her obesity. She was becoming also taller if you looked at her, not just the weight. So I gave her pituitary anterior BD 3 days. After this, most of the acne was resolved. Later on, she would get it again once in a while, but it would never come back at such, in such severe form. Now, when most of the symptoms were gradually getting resolved, I started focusing more on her mental symptoms. She said, she came back on 17/1/2025. She said, "Doctor, I'm having exams, not at all able to concentrate. And because of that, again, I'm becoming a little sleepless because I worry that I will not be able to finish my whatever I have to prepare for by the time I have to sleep." So I just took these two symptoms. Mind thoughts intrude and crowd upon each other. Mind concentration difficult, one subject on. And I took one delusion of cannabis indica. Delusion with regard to time. You can look at the time delusion in a different manner. You can think of the time, going too slowly or too fast. Cannabis indica is actually indicated in either of those cases. You can think of it as a primary and a secondary symptom, whichever way, but they're indicated in both situations. So cannabis indica, and in her case, not having enough time, exam, and so her trying to stretch the time by, going by working hard and studying late at night. Cannabis indica was clearly the prescription. So she told me after cannabis, and the follow-up was on 5/2/2025, she said crowding of thoughts is much better than before. She has been able to do well in most of her exams. She told me that the shyness and social anxiety उसमें कोई बदलाव नहीं आया है. There is no change in her bashfulness, her shyness, and her social anxiety. It still persists strongly. Now, I was thinking that cannabis indica was her constitutional remedy, that this remedy would do her the utmost good, because the crowding of thoughts which could not be influenced by any other remedy, including lechesis, including tuberculum, had got better with cannabis indica. So I repeated it in higher potencies, 10 m. It didn't make any difference. She stayed where she was. So I took the case with emphasis on her shyness, timidity, and this was my main focus. So I took the new repertorial totality. Incredibly, she feels incredibly lazy to get up from bed in the morning, feels better after getting up and moving around. But more importantly, she feels inadequate and timid while interacting with her friends. Very concerned about her obesity, and she has not lost weight so far during my treatment. See, I took all these rubrics: timidity, public, about appearing in; timidity, company in; general's obesity. See, ambra gricia can be very, very thin, but it can even be very, very obese also. A lot of cases, in fact, the majority cases of ambra gricia are obese. Unfortunately, that is not there in the repertory. It is not represented in such a high, with such high marks in the repertory, but that doesn't mean that it is valued less. There was a certain dwarfishness in her, in terms of her timidity, in terms of not being able to grow up. She was typically, she had become inward. She had refused to grow up. So all these things, and I was struck with ambra gricia. It was more of, a prescription that was based on looking at it and then understanding and then knowing the essence of ambra gricia beforehand. If you don't know the essence of ambra gricia beforehand, it is very, very difficult to spot. So this is just a small snapshot. But for example, if I had not put lassitude, morning bed aggravated in, you would have gotten baraita carb, and you would not have gotten ambra gricia until much later. So you would see natremur, you would see lechesis, you will see all these things. So the knowing the essence of ambra gricia becomes very, very important for the case. So that is what I'm going to share next. But anyway, she received ambra gricia 200 twice daily, 5 days on 28/2/2025. It did not have any change. Then I said, okay, this matches her essence. So I ramped up the potency. I said, 𝐬𝐩𝐞𝐫. And to ambra gricia 1 m repeated twice daily, 5 days, she responds within 3 to 4 days. She told, मुझे 3-4 दिन में फर्क नजर आना शुरू हो गया. I started feeling the change within 3 to 4 days. She says she feels like a new person. She says the timidity and bashfulness are about 80% better. She feels like she has gone back to being the way she was in her teens. So she continues to feel better, and so I have kept her on placebo. Okay, today is probably 10th April. Still she is on placebo. What are the key pointers of ambra gricia? They're extremely shy and bashful people. They have a history of severe repression. They have extreme social anxiety. They cannot communicate well with humans. Hence, they have pets, especially cats. They have an awkwardness of communication and extreme embarrassment. The awkwardness of communication is very, very evident. They will be inhibited when they talk to you, and you can feel it. It is something that is a kinesthetic feel that you get when you talk to these patients. So let me just keep my... Okay, so it's a kinesthetic feel that you get when you see these patients, the inhibition, the lack of free flow in the talk, and they are aggravated from emotions. They can cry easily. They can cry listening to music. They may get asthma during sex, palpitations during sex, these kind of things. Anything that involves emotions, they are not able to tolerate. And you can see the repression, you can see not just in the mind, you can see the repression in the menstrual cycle completely shut down, you see. You can see the repression in the obesity and hypothyroidism, completely the thyroid gland shuts down. So when you see repression, this level of repression in both the mental as well as the physical realm, it is nothing but ambra gricia. And then once you see it in the repertorization, you will immediately spot ambra gricia. So this is the cycle of ambra gricia. They are deeply introverted, much more than natramure. They have deep emotions which need to be expressed, but it is very, very difficult for them to express it. And so they express it with cats, some pets like that. Then communication comes out in an awkward fashion, very, very inhibited communication. Then when it comes out, they feel extremely embarrassed about it. They may develop some kind of blushingness of the face because of it. Then they start hiding themselves from society. They are not sure, they are not confident about themselves. Again, they get introverted. So this is a cycle of amblyopia, and I will linger on for a few seconds before I go on to the last case. It's a small case, will take about 5 minutes, but I wanted to share that last case especially because I wanted to tell you what is possible with homeopathy. So this is a case of loose stools, okay? And you will get to know presently why I call this a case of anxiety. Okay. So now this is a case of a female aged 34 years old. Her first visit was on 24th March 2024. She says that, basically she's suffering from loose stools 3 times in the last 1 year. The last time the loose stools was there, was about maybe a month back or so. And she had loose stools for almost 1 month. She had to go to the hospital for emergency where it was treated with antibiotics and probiotics and prebiotics, whatever. Then after some days, she says this problem, the first time she was hospitalized or she had to take medicines was about 1 year back. And she had done it 3 times. The last one was about 1 month back. Not 1 month back, about 1.5 months back or 2 months back, which lasted for a month. So she says that her menses cycle has become abnormal since the last 5 to 6 months. It has turned, the menses color has turned from red to saffronish. She used the word red to saffronish. The last menses, as I have told you before, was accompanied by severe loose motions for which antibiotics and probiotics were prescribed. First prescription was based on her depression, which she complained of, that she suffered about 20 days back, 25 days back. She says she's okay now, but she had recently suffered from depression. She felt her husband was ignoring her. She felt neglected, and she would persistently think of negative thoughts. So based on that, based on her warmth aggravation, okay, and based on, she was also equally a hot person. She had a lot of heat in her body, but she was feeling chilly also. So this dichotomy was there. So anyway, I took both of them and I prescribed her Lechesis 1 once daily for 6 days. So after this, after Lechesis, she felt better immediately. Loose motions reduced, energy became better. Now Lechesis is a little bit like 𝐬𝐞𝐚𝐤𝐞𝐫, okay? It removes quite a lot. It's like, it's a detoxifier. And it's like sulfur also, 𝐬𝐞𝐚𝐤𝐞𝐫 also, because it helps clarify the case in cases where it is reasonably indicated, in cases where the symptoms match, at least to a great extent. It need not be the perfect simillimum. So on 29th March, again, she comes up, she says her menses started, and along with this came the loose motions again. I said, let us wait. The following night, on 30th March, she said she was having very high fever. Night, I told them, today it was they called me at around 10 o'clock. I said, don't give anything to her, not even any 𝐾𝐻. You please bring her to my clinic the following day. The following day, they brought her to my clinic, and the husband said that he was forced to give Calpol 𝐾𝐻 because the fever had gone up to 104.5 degrees Fahrenheit. So the husband told me in the clinic the following day that after he had administered Calpol, she started having vomiting sensation and vomited twice in the night. She was also having loose motions earlier. The loose motions had not stopped, by the way. She was having loose motions. She was having now vomiting, and she was extremely tired, and she was having fever. I asked him, did you measure the temperature at home? He said, no, but it looks like 102. So I told him that the Calpol had caused a new symptom, and we have to at least give her temporary something to set that right. And I looked at the temperature. It was 105.6 degrees Fahrenheit. So I gave her a dose of 𝐬𝐸𝐞𝐫 10 mg. And again, the reasons for giving 𝐬𝐸𝐞𝐫 10 mg were primarily, there was a lot of some amount, certain symptoms of 𝐬𝐸𝐞𝐫, certain mentals that would match 𝐬𝐸𝐞𝐫, but more importantly, because of whatever 𝐀𝐻𝐿, whatever that thing had done to her, I wanted to just clarify while I looked at her case in detail. What I found out was she was a loquacious, extroverted lady who loved to interact with people, which is why I prescribed lechesis before. But however, when it came to her own situation, she would not speak of it to anybody, but would silently suffer. This was a duality, and this was duality number one. Then second, she said that there is a lot of heat in her body, but she cannot tolerate cold. This is duality number two. Her husband said that whenever his parents visited, she would become extra conscious and would work to ensure that everything was in order and would forget to take care of her own health during this time. Little bit like Oculus, somebody visits relatives, they forget carcinosin is very, very, whatever remedy that we are going to prescribe to her is very similar to Oculus. They forget about looking after their own health. They don't sleep nights properly. They are busy taking care of the guests and looking after other people. So she would tire herself out, and even if she was not physically well, she would not mention it to anybody. So based on this, that when I see, generally, as I said, when I saw all this duality and I repertorize the duality, it comes out even in the repertorization, I see that this remedy is carcinosin. As I said, carcinosin has very quick pointers, which we'll talk about presently. Okay. But importantly, what happened after I gave carcinosin 10 mg? 31/3/2025, 12:50 p.m. carcinosin 10 mg was given. Temperature was 105.6 degrees Fahrenheit. No antipyretics, no crocin, no Calpol was given. After roughly an hour, temperature had reduced by more than a degree. Headache was better. Vomiting sensation was better by 50%. 3:40 p.m. temperature was at 104.1 degrees Fahrenheit. She continued to get better. And on the 1st of April, the night at 9 p.m., I gave her a second dose of carcinosin 10 mg after nearly 24 hours. I gave this considering the persistent loose motions and the tiredness and the temperature, which was about 102, which was refusing to go further lower. So she became well after the last dose of carcinosin. Temperature remained normal. And after roughly 5 to 6 days, husband again contacted me saying again she's having loose motions. And she was feeling very fatigued. Temporarily, I said, you give that lechesis 1 mg, it will temporarily halt the loose motions. I knew this because I had given that remedy before. I knew that this would work, at least as a temporary measure. So when you take this the case of a person and give them remedies in sequence, and you have the remedies properly documented in your logbook, you know what to do, at least temporarily, before you actually come and peacefully look at what exactly the remedy that he or she would require. So following day, I took the repertorial totality, very fatigued from discharges. She says, I'm feeling very chilly. And she has a history of prolonged loss of vital fluids. Very clear when you look at the keynotes. This is the keynotes of China. You can only see China. China 1 mg BD 5 days was given. And, today, basically, her loose motions stopped after that. And this is a case in progress. She may still require further remedies, but she's feeling much, much better. The first day, what she said was that her motion was not that watery. The first motion was not that watery. The second and third were watery. She says, even though she passes loose motions, the fatigue, she's not feeling fatigued anymore, which is what is the main key symptom of China, that they become fatigued because of lots of loss of vital fluids. She said there was some rumbling sensation in the stomach. And basically today, this is a recent case. I took her case, that there is basically one well-formed stool today morning. So that is the end of the case.
Thank you, sir. Thank you for enhancing our knowledge on Hanuman Day. We are so grateful to have you on our platform. Thank you so much. And I think many of the doctors have enhanced their knowledge with your knowledge too. So thank you for your time and thank you for the knowledge.
Thank you.
I think